Hello, you're tuned into daily coronavirus updates. Today is the 19th of May and you're watching The Wire. The number of cases in India has crossed the 1 lakh mark. More than 39,000 people have recovered and over 3,100 have died. Maharashtra continues to remain the worst affected, followed by Gujarat and Tamil Nadu. In Maharashtra, Gadchiroli was so far the only district with no coronavirus cases and was declared a green zone. But yesterday, the district reported 3 coronavirus cases. The 3 people who have tested positive had returned from Mumbai and were in institutional quarantine. In Kashmir, 5 more doctors tested positive, taking the total number of virus-positive healthcare workers in the valley to 16. Meghalaya's chief minister announced yesterday that there are no patients under medical supervision anymore. The state has recorded a total of 13 cases so far, but no active cases as of now. Across the world, there have been over 47 lakh cases and over 3 lakh deaths. According to a report published in the Economic Times, ICMR is contemplating a revision of its recommended use of hydroxychloroquine for COVID-19 treatment. People aware of the matter told the newspaper that after ethical questions were raised about the therapy, certain microbiologists oppose the use of HCQ, sparking a rift. After the pandemic hit India, ICMR had recommended HCQ as a prophylactic for asymptomatic healthcare workers. Even then, some healthcare workers had cautioned about the side effects of the drug for people with hypertension and heart-related illnesses. HCQ was recommended to frontline workers in India on early findings from Petri dish demonstrations and not randomized control trials. US President Donald Trump also touted the drug in his country. However, earlier this week, first randomized control trials of the drug have shown that it has failed to show any positive signs in combating COVID-19. 2 separate trials in France and China have revealed this. Nations who support HCQ's use as a prophylactic for frontline workers are yet to respond to the results of the 2 randomized control trials. According to a report published in The Print, relatives of COVID-19 patients are helping with treatment at King Edward Memorial Hospital and Lokmanya Tilak Municipal Hospital. These 2 hospitals are reportedly facing a shortage in healthcare workers after many staff tested positive for the viral infection. A resident doctor at the Lokmanya Tilak Hospital, which is also known as Sion Hospital, has said that relatives had to step in to take care of patients because several healthcare workers have been infected. A large number of patients at this hospital are from Dharavi. While some relatives said that hospital authorities requested them to stay and help with the treatment of patients, others said that they took the decision on their own. According to a report published in Ahmedabad Mirror, Ambu-bags are being passed as ventilators and are being fitted in several hospitals in Ahmedabad city. On the 4th of April, Gujarat's Chief Minister Vijay Rupani inaugurated Gujarat-made ventilators at the Ahmedabad Civil Hospital. 15 days after the machines were fitted at several government hospitals, it was found that the machines are automatic Ambu-bags and not ventilators. A senior bureaucrat also told the newspaper that it was embarrassing for the Chief Minister to pass Ambu-bags as ventilators in the middle of such a crisis. Another bureaucrat told the newspaper that the Chief Minister never called the machines ventilators, but government documents accessed by the newspaper show that these machines were being referred to as ventilators in official letters and notices from the start. The newspaper has also highlighted that the owner of the Rajkot-based company from where the machines were purchased is a friend of the Chief Minister. A person who works at one of the hospitals where these machines have been fitted has told the newspaper that the machines can only be used as an interim measure for patients before putting them on a proper ventilator. The Federation of Resident Doctors Association has written to the Ministry of Health and Family Welfare asking for guidelines on quarantining of healthcare workers to be revised. According to guidelines issued by the Ministry of Health on the 15th of May, quarantining of healthcare workers has only been advised in case of high-risk exposure or if the health worker reports symptoms of COVID-19. But the association in their letter has highlighted that many asymptomatic doctors have tested positive too. They have said that given the incubation of the virus is 2 to 14 days following exposure, 14-day quarantine along with testing for all doctors and healthcare workers after COVID duty is a necessity. India has joined over 100 countries that have moved a proposal at the World Health Assembly to identify the zoonotic source of the coronavirus and have asked for an impartial, independent and comprehensive evaluation of the WHO's COVID-19 response. China and the United States are not a part of this resolution. This is the first time India has taken a position in an international forum on the origins of the virus. After opposing this move at first, China's Xi Jinping on Tuesday agreed to an independent inquiry once the pandemic is over. Last month, Australia was the first country to call for this inquiry. For more coronavirus updates, news and analysis, keep reading and watching The Wire and The Wire Science. We will see you tomorrow. Until then, stay safe.